This is a proposed study about acute chronic workloads and injury risk in professional soccer players. Soccer is a demanding sport, and players experience injuries, especially overuse injuries. As one would expect, lower injury rates during a season tend to correlate with higher team performances. The acute-chronic ratio compares the work, either internal or external, done in the short term to that of the work done in the longer term. And a link between these acute-chronic ratios and injury risk has been assessed in several sports, but more work is needed to understand it better in professional soccer. Initial studies suggest that an acute-chronic ratio between 1 and 1.25 is optimal for reduced injury risk and increased performance in professional soccer players. So we want to look at whether players at this performance level experience loads that might increase their injury risk, and we also want to see if there's an acute-chronic ratio at which injury risk increases at this level of competition in order to confirm previous work. We want to add to the literature base by quantifying training loads across a competitive season in United States-based professional soccer players. We also plan to compare acute-chronic ratios by internal and external loads, and then increase knowledge of injury risk in order to limit the unnecessary overuse injuries for professional clubs. 22 healthy male soccer players aged 18 to 37 are in this study, and all participants had to be free of cardiorespiratory, metabolic, and neurological conditions. The participants also had to be cleared to fully participate in sport by the club's sport medicine and soccer coaching staff. A movement system that accurately tracks performance statistics is used in this study, and an example is shown in this picture. Here we have some of the variables that are recorded by the movement tracking device. In order to calculate the acute-chronic ratio for any one of these given variables, we simply add up the work done over the course of 1 week, and then take that value and divide it by the average of the work done over the previous 3 weeks. And that gives us our acute-chronic ratio. We will perform repeated measures analysis of variance to compare acute-chronic ratios during non-injured periods to those ratios prior to injury. The period will be back calculated from the injury occurrence. Injury severity will be classified as light, moderate, or severe based on the amount of time the player misses. We expect workloads to be higher in preseason than in season and postseason, and it should vary throughout the week. We also expect variance between starters and non-starters and position groups. Spikes in acute chronic workload are anticipated to be related to overuse injuries. Potential limitations include that our data collection is limited to only one team over the course of one competitive season. Also, not all athletes will wear the GPS monitor at all times. Some may prefer not to during games. Furthermore, coaching and roster changes could significantly change workloads. And finally, the exact mechanism of injury is sometimes entirely unknown. Here are all of our references from across the slides. Only one of these references specifically spoke on the acute chronic workload and soccer players, and they discussed English Premier League soccer players. So we look to add to that research base. I have a few questions for the audience. Are there any specific measures of load, either internal or external, that might be the most appropriate for this analysis? And then there's a lot of options for statistical analyses. Is our approach the right way to go with this study, or should we consider other statistical analyses? And finally, if injury data isn't available to us, can we consider previous acute-chronic ratios as meaningful enough to apply to this study? Thank you for your time.